Good morning, everyone. Thank you for coming to our public informational meeting on our syringe services program here at Fargo Public Health in the city of Fargo. For those that don't know, my name is Ruth Roman. I'm the director at Fargo Public Health. And again, I just wanted to welcome you all. We have a fairly small group here, so I think so that we have our nice informal community-style meeting. I think it would be helpful if we just went around the table quickly and introduced ourselves so we know who we're visiting with this morning. So,
thank you. Bruce Grubb, Fargo City Administrator.
Nancy Morris, Assistant City. Go ahead. I'm sorry? Nancy Morris, Assistant City Attorney.
Shannon Rosiska, I'm a lieutenant with the Fargo Police Department.
Robin Litke-Sal, Prevention Coordinator with Fargo Public Health.
Jillian Gould, Homeless Outreach Specialist with the Gladys Ray Shelter and Veterans Drop-In Center.
Jan Eliason with the Gladys Ray Shelter Vets Drop-In Center and Fargo Public Health Withdrawal Management Unit.
Jeremy Kelly, Harm Reduction Specialist, City of Fargo and GRS.
Ryan Braunberger, Community Co-Chair for the Community Planning Group for HIV and Hepatitis C Prevention for the state of North Dakota.
Kim Hegvik from the Cass County State's Attorney's Office.
Nate Mayhew is President and CEO at Chairhouse.
Jeff McKinnon, Director of Substance Use Services at Southeast Human Service Center.
Brenton Niestemeyer, Field Epidemiologist for the North Dakota Department of Health.
Caleb Moore, I'm an advocate for the Gladys Ray Shelter.
I'm John Strand with the Fargo City Commission.
I'm David, otherwise John Q. Public. I have no great interest one way or the other in this. I'm just here because I heard about it.
Tony Garrick, Fargo City Commission.
Kate Nauman, Cass County State's Attorney's Office.
Mark Baining, Cass County State's Attorney's Office.
I am Brina Welton. I'm the administrator at Ransom County Public Health in Lisbon.
Brenda Stallman, Administrator at Trail District Health Unit in Hillsborough.
Brenda Peterson, Administrator at Sargent County District Health in Foreman.
Holly Scott, I'm the Communications Specialist for Fargo Public Health. Do we have?
Mark Johnson, Facility Manager for Kilburn Group.
Late arrival. I'm Merrill Pepcorn, State Senator from North Fargo, District 44.
again, thank you all for being here. Oh, sorry.
I'm Mike Redlinger, City of Fargo staff.
Linda Anderson, support staff, Fargo Public Health.
Great, thank you. I'm going to turn it over to Dr. John Baird. Dr. Baird is our health officer at Fargo Public Health and also the Cass County Coroner, really our subject matter expert in this topic, and I will let him take it from here. Thank you.
Great, thank you very much. We're, as Ruth had mentioned, we're looking at syringe services program here in Fargo to address some of the needs of our community. This was a topic that we addressed at the last legislative session in Bismarck, and the legislature authorized this sort of process to be done in the state. And part of the process is the state health department authorizes such a program, and they want to have us be sure to have a public meeting to let people know about what's going on, and we also want to let everyone know what we're planning and just to kind of give some background on it. So let me just work my way through a few slides that we have here. The Fargo Public Health Syringe Services Program team is myself, Ruth Roman as our Director of Public Health, Jan Eliason, who introduced herself as the Director of Gladys Ray Shelter and Veterans Drop-In Center, Jeremy Kelly, who's our harm reduction specialist, and I think I'll mention him again later in the presentation. He is the founder of the Good Neighbor Project in Moorhead, and which is our predecessor, really has started this process before we have. And then Robin, who introduced herself, was our substance abuse prevention coordinator. And any of them can or anyone can make comments or ask questions and as we move along here. With this presentation, I just want to look at the problem a little bit, to explore the impact, some solutions that we've been looking at, talk about intravenous drug use in our community, and then describe our program, our syringe services program, ask for any input and comments that people have and questions. So we do have people in our community that use intravenous drugs, use drugs non-intravenously and also intravenously, and people are dying, and disease is spreading in our community. It's hard to measure how many people are using drugs, so we use indirect measures, and unfortunately, one of those measures is how many people die in our community, and it's something as the coroner, I get involved with that and look at it, and we've had, in 2017, we had 17 people die of opioid related causes, which was down from the previous year in 2016, which is a good sign because there's been a lot of effort put in to try to assist people that are using drugs and to try to get help for them. The broader category of drug-related deaths, we had 33 deaths in 2017, and those include the opioids, but also include things like methamphetamine, cocaine, and other drugs that people are using in our community. And so each one of these deaths is tragic to that individual and to their families and friends and our community. And so it's something that needs to be looked at, and we are looking at. One of the things about intravenous drug use is that it's the primary method really of spreading hepatitis C and HIV. It's infectious diseases, and this is from the State Health Department. In 2017, the preliminary data is that we had 236 new cases of hepatitis C reported in Cass County. And people that get tested, that go in for testing for hepatitis C, one of the there are a number of risk factors. Several of them are sexual transmission, but also intravenous drug use and having sexual relations with someone who does use intravenous drugs. And that raises someone's concern that they could have or be exposed to hepatitis C. So what's the impact of addiction? People that are addicted to drugs, intravenous or non-intravenous, come from all walks of life. We've seen that with the people that have died and the families that have given testimony on their loved ones that have suffered with this problem, and it's difficult to stop. When someone becomes addicted to drugs, it becomes the focus of their life, and they want to get more drugs in the next dose and keep themselves as stable as they can, and they get trapped in this cycle of addiction. And the body gets gradually destroyed by drugs and the diseases that they're exposed to. And so the impact to our community, I mean, those individuals' lives are impacted, their family, friends are all impacted, and so we have a number of individuals in need of help and of helping them to find solutions for their lives. And when it's involving intravenous drugs, contaminated syringes that are around the community, we encourage, and that's part of our program, is encouraging removal of those from our community, getting rid of the contaminated syringes, but those are a risk to the community. Sexual contact with infected individuals, and the high cost of treatment. I mean, to treat hepatitis C is over $100,000 to treat it, and so someone who has hepatitis C and is trying to treat it, it's an extremely expensive disease, and that falls on all of us because our insurance payments or our medical assistance or whatever people might have or public care, it's going to cost our community in some way. HIV is an ongoing treatment and is also extremely expensive. So what do we do to help? There's a lot of efforts going on in the community, and this is just one effort, the Syringe Services Program that we're talking about today. We need to support these individuals, support families that are having problems and trying to address problems with their loved ones. So family and friends, and reducing stigma. I mean, the stigma is that, someone who uses drugs is weak and they can't take care of themselves, and it's something we shouldn't talk about, and someone who's having problems, well, then we should ignore them and not even talk about these situations. When it could be anyone. Anyone could become addicted to drugs, and people that we know and love can become addicted to drugs, and it's not, it's like any other thing. Someone has diabetes, we talk about it. Someone has a heart attack, we talk about it. But if someone has an addiction, then we try to hide it away, and it's something that we need to address. Treatment is available in our community. We have a lot of good treatment programs. We have a new medication-assisted treatment program for opioids, a methadone clinic, community medical services that has a number of people that are receiving treatment there to stabilize them, stabilize their lives so that they can get on with their lives and get a job and be productive members of our community. And then recovery, supporting people in recovery. Recovery doesn't mean that they're going to abstain forever. I mean, it's reducing the harm. It's encouraging people to go day by day and continue to deal with their problems and to find answers for themselves. So intravenous drug use, it's part of our community, and it could be anyone, and it can start with using prescription drugs and getting addicted to pain medication and needing more, and getting to the point where, because one of the things with addiction to opioids and to pain medication is that the effect doesn't work as well, and you become tolerant of it, and you need a little more and a little more, and so pretty soon, and you get a better high if you inject, and so people are crushing pills and injecting or doing various things or buying them on the street, and then turning to heroin and other drugs that could hopefully give them a little bit better of an effect than they've had. And it could be anyone. They can get started in any number of ways, and so they use intravenously to improve the effect of it and to feel it. And that adds all kinds of dangers, because when these drugs are purchased illegally, you have no idea what's in them. You're told that this is heroin, or you're told that whatever, and you inject it to see what happens to you. You don't know where it came from, if it's contaminated, what other problems are going to happen. So there's all kinds of dangers. And the diseases that we talk about, HIV, hepatitis C virus, and then sexually transmitted diseases when people are under the effect of drugs and passing other infectious diseases. So those infectious diseases are spread from one person to another who is infected by sharing needles, sharing equipment, and then sexual transmission. So what are we talking about with our syringe services program? It's often called a syringe exchange program because we think of exchanging dirty needles for clean needles and that sort of thing. But it's all the services that go along with helping someone to find some help. And so we want to have a safe, trusting place where someone who is in trouble can come to get tested, to get some sterile equipment so that they're not exposing themselves to others' infections, and where they can get advice and assistance and how to get some help for themselves. So we'll collect contaminated syringes and needles and dispose of those, and even now our staff will go out to areas where there might be some needles and are collecting those. We have people doing that, and this would be a place where someone could come and drop off their needles. And then we want to provide clean, sterile syringes and needles and supplies so that they know that they have something that's safe for themselves to use. And educate the individuals about the risks of infectious diseases and sexually transmitted diseases. Give out Narcan. With opioids, we do have Narcan available, or naloxone, which can reverse the effects of opioids. It doesn't do anything for methamphetamine or other drugs. But someone who you don't know what's in the substance that they're taking, and they overdose and die. And we're distributing that in general in the community. Law enforcement carries it, the ambulance carries it, fire department carries it, and people are responding to emergencies, but it has to be used fairly quickly when somebody's in trouble.
And we will have testing for HIV and hepatitis C. We'll do rapid testing on site. And then if something turns out positive on a rapid test, we'll assist that person in getting confirmatory tests done. At our main clinic site on 13th Avenue and 25th Street, we have testing available for hepatitis C and HIV and sexually transmitted diseases. And so we'll bring people there to get further testing. And then refer to healthcare. If they have health problems, try to get them in with healthcare providers. There's a number of providers in our community, and refer for treatment, for chemical dependency treatment, and to find them some help and talk to them about the options that are available. Questions come up about, are we facilitating drug users? Are we giving them clean equipment so they'll continue to use drugs? Well, really, the studies have found that if we have something like this, providing sterile equipment, we decrease disease, decrease the transmission of disease, and actually encourage people to stop drug use. And it has the benefit of a place to talk about how to get treatment, and drug use decreases with this sort of service and does not encourage drug use. So it's an important way to refer people to treatment. So our program that we're proposing and the steps that we'll have to do from here is the City Commission will hear this, not this full presentation. We wanted to have a little more time to talk in more detail, but we'll bring it to the City Commission on February 12th, I believe, to get them their discussion, their input. And then we get approval by the State Health Department Disease Control Division that is directed by the legislature to authorize these programs and to monitor what we do, and we report to them every 6 months on what we do. So we want to be a good neighbor in our community, just like the Good Neighbor Project that started in Moorhead. We want to reduce stigma, reduce harm, and reduce disease transmission in our community, educate individuals and test them, HIV, hepatitis C, sexually transmitted diseases, make referrals for treatment, distribute clean and sterile syringes and equipment for injection drug use, and collect contaminated materials, get them out of our community, get contaminated needles out of the community, and then address addiction, help people to find treatment. So thank you. Any questions or things that people would like to comment or get their thoughts on out?
Where will the collected needles go?
We already have arrangements for medical waste that there's a medical waste handling company in town that we use for our current medical waste, and they'll pick these up and destroy them. I believe they incinerate them, is the way that they destroy them. Yes, sir.
Where do you think you're, because I can't think through this myself, I guess.
Uh-huh.
Is there going to be one location? Is that going to be at the community health location?
Good question. The city has a building right downtown, just north of the depot, north of the tracks, near the water tower, 5th Street and 5th Avenue North, I think. There's an old sign shop that we're going to use as just a kind of a small, quiet area of the community for people to drop in. We'll be open a few hours a day, and I mean we can do some of this at our main site, but to be a location where people feel safe and not intimidated, we're going to have that location.
When do you hope to be up and running?
Well, if we can get City Commission approval and get authorized by the State Health Department, just depend on how quickly that goes. It would be nice to be open in mid-March.
Dr. Baird, I'm just curious what type of vetting, like I know when we were working with our team on the methadone clinic, a lot of stakeholders were at the table, law enforcement and others. How did this get processed in our community so that all the i's are dotted and t's are crossed and all the concerns are addressed proactively?
Right. Well, the police department has worked closely with us on a number of projects, including community medical services and now this, and we've talked to our other, at the Blue Ribbon Commission on Addiction, the Mayor's Blue Ribbon Commission on Addiction. We've been talking about this and talking with all of our partners to, so that they're aware of it and part of the process.
How's it funded?
It'll be funded in the Health Department's budget, but including some grants. The State Health Department, through some of their HIV Ryan White funds, are going to be assisting us. The Department of Human Services has money that we're using for purchasing Narcan and some of those things. There's a national NASON, National Association of Syringe Exchange Programs, that helps provide some money and actually cheaper purchase of syringes and things like that. We can't use state or federal money to purchase actual syringes and supplies, which is a small part of the expense. The expense is more personnel and expertise and some of those things. Yes, sir.
Doctor, we certainly aren't the first community to try this. So what community are we modeling? What community can we look to and say, here in City X, they tried this exact program, addictions or use went down by 20%, STDs went down by 15%, and that's why we can say this will be successful here in Fargo.
Yep. These syringe exchange programs and syringe services programs have been around since the 80s. Started first in like Boston and Vancouver, British Columbia, and San Francisco, and has spread to many other areas in the country. So we're by far not the first to do this sort of thing, and they have studied those sites quite well to see the improvement that they found in the community and the benefits. Minnesota has them. Jeremy started his program in Moorhead, and technically, we may have been able to do this in North Dakota because people can buy syringes at a pharmacy without a prescription, and people are able to get syringes, but it's difficult. But to wrap around the services of testing for disease and getting education and encouraging them to get treatment, we wanted to make it a more of a package. And so when the legislature authorized that, then that's when we decided to get into it.
Just as a follow-up, since this will be coming to the commission, a suggestion from me would be to have some data, some specific data, just to show to us so that we can show to our constituents, because I've already heard concerns from people that are not in favor of this.
Sure.
And I want to be able to look at them and say, here's the real data about how this is helpful and how it does not increase use and things like that.
Right.
And if I can hand that to them in an easily digestible way, I think you'll see a lot more support for it.
Yeah. What concerns have you heard in specifically?
You addressed it here. I mean, the question is obvious. Will this increase usage? Will it make it easier for people? Will it promote drug use instead of deter it? And
Sure.
I think that a large part of the conversation that's missing is this is not just about giving people free needles. This is about those other services that you're talking about.
Right.
And I think that people, unless they are shown that up front, they will not assume that as part of the process.
Sure. No, I appreciate that. Yeah, because unfortunately, if people are using drugs, they'll keep using them, and if they have to use dirty needles and share them and use them over and over, they will, and that only increases our problems. Yeah. Thank you. Other thoughts? Any of our team want to make comments? Jan always likes to make comments.
Sure. We're aware that there are going to be concerns in the community, and I feel really, really fortunate in the work that we've done, not only at the Gladys Ray, but out in the community, and of course with withdrawal management, or formerly called detox. We know folks firsthand that are struggling with this issue, and we really do believe that they deserve to have access to something better, something that can help them stay as healthy as possible until the resources are there, or until the the will, in some cases is there to help people get into treatment and start reaching for something else. And, we really believe that people can recover. Recovery and the definition of recovery is changing every day in all across, America and certainly here. And this is part of that, helping people stay as safe as possible. Our community, is only as safe as everybody, can be. Of course, I believe that. And if there's a group of folks in our community that don't have access to the things to stay safe and healthy, that really affects the rest of us. It's going to affect us in one way or the other. So the folks that we know, it is about dignity, it's about safety, but it's not just about serving those folks, it's about our community safety and serving the community in a much different and a much more effective way than we have historically.
Great, thank you.
I'm Jeremy Kelly, the Good Neighbor Project. I've been doing this for about 3 years now. I've researched it a lot over that time. And all the numbers are, that come out of this kind of stuff are real positive. And I've never heard of anything negative coming out of, one of these organizations that does this kind of thing on just about any topic you can imagine, related to it. I know that people are going to use no matter what, whether they have cleans or not. I know just through my experience in this, I know that, people on the western side of the state who had almost no access to clean syringes are paying like $10 for a dirty syringe, and then, and then spreading disease through it and everything, where, we can get them a clean one for 10 cents and avoid a lot of problems and hundreds of thousands of dollars that the city and medical people would be paying in the long run.
And maybe just for clarity, I'll point out that I'm not suggesting that this is a bad idea. I'm saying that for the general public, we can say that the stats are in favor of it, unless we show them those stats in an easily identifiable way, they're not going to believe you. You know what I mean?
Right.
So I simply just want that to be presented when this information is presented to me at the city commission meeting. I won't be able to say, look, that's why we're saying yes to this. You know what I mean?
Good idea.
Yeah. And thank you for that, because I think it is really important that when we have our presentation at the commission, that we do present those statistics so that the commission can make that informed just choice and decision. So thank you.
Yes, sir.
Cost, what's it going to cost?
Cost? The major cost is primarily the personnel of having our harm reduction specialist working and having the site, having a city building, and the costs of heating it and that sort of thing. The test kits for rapid testing come from the state health department. We use those, and syringes are relatively inexpensive. So really, our budget, as we've just sort of laid it out, and because part of our budget is that the state health department wants us to use our expertise to assist some of the rest of the state, and when other areas around the state need technical assistance, they want us to help them look at how they can develop a program. So we're looking at about $130,000 budget which includes this grant from the state health department to help pay for technical assistance.
So that means if you keep 2 people from getting hepatitis C and having to pay for the cost of treating 2 people, you're already money ahead.
Yes, definitely. Yeah, thank you. Yes, Commissioner.
Thank you, Dr. Baird. I'm so proud of our team. We have an absolute crisis going on across the country. And when some of us travel around and see what other cities and communities and states and governments are doing with this crisis, we can be proud of what's happening here in Fargo. We're a small enough community to care, but we're big enough to create some action fast. And what we've been doing in the last few years, and you saw it in the statistics earlier, and yet addiction's way more than heroin. But what we've done here is absolutely stellar. And the partnerships with all the government subdivisions, the law enforcement's just been key. In fact, it started with law enforcement here in town, alerting our community of the crisis that we have at our door. When the first discussions happened about a methadone clinic, we're sitting around the table and people are saying, well, we gotta go to the community because we're gonna have pushback. And I spoke up and said, you know, we'll have pushback if we have more deaths and there's a crisis. And our community is expecting us to act. And this is a different time now today with this stage in this crisis versus a few years ago. So when people talk needle exchanges and syringe support programs and methadone clinics in the past, they didn't have this looming on the horizon, taking deaths monthly of people of their families. So I can't begin to say how proud I am of all of our team, all of our participants, all of our stakeholders, all of our service providers, all of those of you in the trenches, because you're seeing this. And what I know on the other end is not all of us are touched by this. But when you look in the eyes of a mom who's lost a child and tried everything they could. So let's keep this ball going forward. Let's keep this action positive. Let's be doing it for all the right reasons. And let's not let people slow us down because lives are in the balance. So thank you all.
Thank you. Ruth, do you have anything to add?
Just thank you all for coming. We appreciate your time and your willingness to come and help us work our way through this process, because we know it is a process, and we know we want to do it right from the get-go. And getting your input was a very important part of that. We will be taking the comments and the information that we've received today. Part of the state plan that we have to submit needs to have a summary of this meeting, so we will be doing that, and also building on what we presented today for our meeting with the commission in 10 days, 2 weeks, when that comes up. So thank you. We appreciate your input, and we appreciate you taking the time to be here.